Hello, my name is Lorne Brown. I'm the chair of the Integrative Fertility Symposium, and I'm the clinical director of Acubalance Wellness Center in Vancouver, British Columbia, Canada. And I had the good fortune to moderate a professional talk by Dr. Ursula Ritz. Now, she is both Western and Chinese medicine trained, meaning she's a medical doctor, a reproductive endocrinologist, so she practices in an IVF clinic setting. And she's also trained in Chinese medicine acupuncture, so she has a Chinese medicine practice as well. And so I thought it'd be great to talk to her, just some information for the public in general. I will let you know that her practice is in Graz, Austria. Ursula, thanks for dropping in. And so from an integrative perspective, your talk for the professionals was on recurrent pregnancy loss and implantation failure, this integrative approach. So in your practice, if you're seeing somebody that's having some implantation failure or miscarriages, or just in general, people that are coming to do IVF because they haven't gotten pregnant, is your approach, let's do IVF and it doesn't work, let's look at Chinese medicine, acupuncture, lifestyle? Or do you have a preference that people do preconception care before they do the IVF? I guess that's my first question.
Okay. That's, to be honest, it would be the ideal way for me. So that I can prepare them for the treatment, and afterwards I can accompany them so that they come before, maybe for 3 months. And you can really prepare them perfectly for the whole treatment. You can look for the basic problem. And afterwards, when they start with the IVF, you can just follow the treatment, change your acupuncture, change your herbs. Just they can go through this process. And I'm sure, and that's what I see in my daily practices, you can really improve the outcome. And for me, it would be perfect if I can get them 3 months before. To be honest, that's not always possible. When they come to us to the clinic, they have done so many things. They're waiting for such a long time. So sometimes they just want to start with the IVF. So I will also help them. But the best thing is when you get them before. So you can really do a lot of things. And just in case when you have these unexplained problems, so like the unexplained recurrent pregnancy loss or the unexplained implantation failure, this is really the target for the Chinese medicine.
And you talk about the 3 months, and in my training in Chinese medicine, I remember they always said it takes on average 3 months to regulate the menstrual cycle. So if there's PMS, heavy bleeding, pain, treat for at least 3 cycles to see a change, to reassess. What's the Western physiology understanding of why it would be 3 months if you're going to do 3 months to prepare to optimize fertility? Can you explain the reasoning behind the Western understanding of why it could take 3 months to make a change?
Yeah, I think it's the same for men and women. So at least the maturation of the oocyte, and those are the last maturation of the sperm, needs at least 3 months. So when we want to influence the quality of the oocyte or also the quality of the sperm, we have to really go for these 3 months, because we need this whole process that we can make a change. So when we start in this month and make the next one the IVF, then we wouldn't change this, because we need this whole process, and it needs 3 months for both, for men and for women. So it's the same from the Western physiology.
And in your practice, are you just doing acupuncture, or are you doing herbal medicine as Chinese herbal medicine with your patients as well?
I do both.
You do both. Now, I'm curious, and I don't know if you remember this, but when I invited you to speak for the Integrative Fertility Symposium, and we talked about the topic of implantation failure, you said, do I have to just talk about the Western approach? Because in my practice, I like to use herbal. I see that beneficial. So are you seeing a benefit for women that are doing the herbal and diet and acupuncture when it comes to implantation failure or recurrent pregnancy loss?
Yes, of course. Of course. To be honest, I think that the treatment of the recurrent, especially of the recurrent pregnancy loss, is much better with Chinese medicine than with Western medicine. Because in Western medicine, at least, to be honest, we just watch and wait. We have very, very, very slow options. We have nothing to offer, at least. Most of the treatments we can offer are not recommended. Most of the treatments are not proven in studies. So we do a lot of things. We have this big issue of the unexplained recurrent pregnancy loss. for this is for me incredible that we have 60% of our patients without any diagnosis. So they come to us, they lose their baby for 3 or 4 times, and all we can say is we don't have any idea for that. And what can we offer to a patient when we don't have an idea what was the problem? And I think with Chinese medicine, you can do so much, and I have so incredible good results with these patients.
And you're so fortunate because you got the Western training. So you can, like you said, that 40% you can diagnose, but then there's a 60% you can't. And then you have this whole other paradigm where you can explain the unexplainable from a Chinese medicine paradigm and then address it with diet, lifestyle, herbs, and acupuncture. So it's a good fortune that they have you there in Grasse to do that. What about the men? We talk about this implantation failure. We talk about recurrent pregnancy loss. So we're talking about embryo quality here. It seems in the last couple of years that they're starting to look at the men, even if they have a normal semen analysis. I wonder what it's like in your practice. Are you noticing or seeing that men are more involved in this fertility issue than what we've seen previously?
I think it's traditionally that we just focus first on the woman, but of course the man is equal important, of course. And we see that we have 50% of all the problems comes from the man. So it's a big issue. And of course we have to treat the men, and I would like to treat all the men, but to be honest, they are not so willing to be treated. So I think they have a little bit fear of the needles, and they are not so, they're always a little bit concerned of what we are doing. And when you ask them why you're here, 80% will tell because my wife sent me here. It's not easy to treat them.
So it's easy. So you got to hear this. So men are easy to treat if they come to treatment.
Yeah,
so I've been interviewing all the specialists for this conference. So for everybody watching this, and this is the question I ask. And so far, everyone has said men are easy to treat. Men definitely are contributing more than they're aware of to the embryo quality. And for whatever reason, men do not come. And what most of the specialists say, which some people don't like that it has to be this way, it's not fair, but we didn't say life was fair, is the women have to go to their husband and say, will you do this for me? Will you show me that you love me by doing this for me? Like that's how they're getting the men in, which some people say that's not fair. But at the end of the day, that's what's happening in our world today. And yes, we need more movements to get men more involved and to get them educated. And yeah, they are uncomfortable coming to the doctors for whatever reason. And that's globally. It's like I'm in Canada. We have the same issue. The American specialists have had the same issue. The Austrian specialists have had the same issues, right? And so men are easy to treat, but they need to show up. And that's diet, lifestyle, herbal. Most of the men I see, some do the acupuncture. Majority of them are doing the herbal because they don't want, like you say, the acupuncture. And that's been your experience as well?
Yes, of course. Yeah.
I have another question. And so far, everybody, I almost like have 2 camps here. So there is no right answer to this thus far because everybody I've asked has some different way of answering this. But I'm looking at the male influence and the egg influence on the embryo and looking at it in IVF as it grows out. And so question for you is what's your thoughts on if you get a lot of eggs, mature eggs, but you have poor fertilization, are you thinking egg or sperm quality is question number 1. Question number 2 would be, and then they don't make it out to day 3. There's good fertilization, but they don't make it out to day 3. Are you thinking egg or sperm quality? And they make it to day 3, is question 3, but you can't get them to those blasts. Where do you think it's egg and sperm? And I have to say, some say, just so you know, so I want you to hear what some have said that if they don't see good fertilization, they think it's sperm. And if they don't grow out to day 3, they're thinking maybe sperm. But after day 3, they're thinking egg. And some say, no, the first 8 days is the egg. So, so they haven't, and these are IVF doctors, not the acupuncturists, Chinese medicine doctors. These are the reproductive endocrinologists that I've asked. I'm curious what your thoughts are.
Okay. So you're right. There are different opinions of this. First to say, when a patient has a lot of eggs, the question is, what is a lot of eggs? So the ideal amount would be, so we see the best results when we have 8 to 12 eggs statistically. When a patient has 30 eggs, then something is wrong. Normally, these are PCOS patients. So when I have a patient with 30 eggs, then I have to expect that maybe the half of them are not good. So we know the more we have, we just, at the end, we have always the same 10 good eggs. So we don't have normally so many good eggs in PCO patients. So they have a problem in the quality of the egg. I don't think then from the fertilization, I think it's not clear if it's the man or if it's the women, because it could be both. So the fertilization can fail because of a genetic problem of the oocyte and also of a DNA fragmentation of the sperm. When you have a problem between the fertilization up to day 3, I think it's more the problem of the egg, because the DNA of the prescription of the DNA of the man starts at day 3. So all what happens before is normally the women. So when we have a problem in the first 3 days, we would think about the problem in the oocyte. After that, I think it's also not quite clear, but thinking about, okay, first it's the woman and it doesn't happen to the day 3, to the 8 cells, and then there's a problem. Maybe then we can say it's more likely that it's the man, but I'm not sure if we can really define that. But I think it's probably like that.
Thank you. And then if time and money and travel were not an issue, would you want both man and woman to be doing the diet, lifestyle, meditation, acupuncture, and herbal? And would you like them both to be doing preconception care for that healthy baby? Is that kind of what I heard in your talk?
In an ideal world, it would be the incredible thing if we can do something to prevent problems. And that's what we really are not able to see in the Western world. There's no prevention. So we go to the doctor when we have a problem. And so the lifestyle, we do not understand the influence of the lifestyle, I think. And most of the people do not understand how important their nutrition is and how important it is that they do their sports, they do their meditation, whatever. So it would be perfect if they come 3 to 6 months before the treatment, if you can talk to them about nutrition, about lifestyle, when they get relaxed, when you start with the herbs, with the acupuncture, and when after that, they go to the clinic. I'm sure the IVF practitioners would not like it because they will lose a lot of patients on the way. So they get, pregnant before that. In Austria, we have the so-called problem, that it's really easy to get an IVF. So it's not very expensive. And when you come to the clinic, after one cycle, you can start. So we talked when you were in Graz that in the States or also in Canada, the situation is that you get the treatment often 3 or 4 months later. So you have the chance as TCM practitioner to get these people. In Austria, we don't have that. So we have to convince the patients and we have to convince the doctors in the clinic that really would make sense. And the more severe the problem is, that the more important it is to get them earlier. And we are just thinking in time. And I know one of the sentences I first learned when I come to the IVF clinic, my boss always says, speed is the name of the game. So this is his most beloved sentence. And I'm sure that this is not true for the most of the patients. That might be true when they are 42 but I don't think that there is the situation of this last good egg. And they always give the image to the patient. So you are so old now and you have such a less reserve and bad quality egg. Let's do it now and again and again and again and again. And the statistic says, okay, when you're 42, then you need 15 blastos to get one good. And the idea is do 15 IVF cycles and then you have a chance. And I think that's the wrong way. So when we treat them before, when we get them before, then maybe she would need 2 IVF cycles. But it's not so easy to convince.
It's probably reassuring for the public listening to this, because when an acupuncturist, Chinese medicine doctor, naturopath say, I want you to do the preconception, they're saying, well, my IVF doctor says I can't wait. And they're feeling, well, you want me to do it because it benefits you as a practitioner. When they hear the IVF doctor say it, well, they're saying age and here's all these stats, but they're also benefiting. And it's nice that you do both. And so the fact that you have IVF as a tool and you have acupuncture and herbal, and you're saying really, if you can do that preventative and preconception, you may not need IVF. And if you do still, maybe you don't need to have as many. And our goal still is that healthy baby. So thank you for sharing that. I appreciate hearing that. And I'm sure the public appreciates that as well. In your talk, you talked about the Chinese herbal and that there was some connection to kind of how your Western brain was thinking. And you had talked in your professional lecture about the mitochondria and how important that is, the battery cells of the egg and the sperm, and how important that is for fertilization and implantation. What was the connection that you were seeing that you thought was interesting? Because the Chinese herbs that we think of very strong in energy, these yang herbs, I think you saw a connection with ATP potentially. Can you elaborate a bit on that?
Okay, yeah, this is really interesting, and it's something really amazing for me. They did a lot of studies on the pharmacologic function of herbs. So they look what are they doing from this. When we in TCM, we talk about yin tonics, yang tonics, we talk about qi, we talk about the jing. So this is a completely different description. And Western doctors always look and say, what are you talking about? And what does it mean? And now they do a lot of examination of the pharmacologic, and they found out that there are really a lot of functions which, like in anti-inflammatory, we have immunostimulant, we have antibacterial functions, we have herbs which have an anti-aging function. So they found out that we have they are against hypertension, antiplatelet. So they really get these different functions. And when you then have a look which herb has which function, then it is amazing, because you can translate this easily from what this for what we would use it. And it really is really good to get it in both systems. So it's incredible how the old Chinese 2,000 years ago can use these herbs, and now we see when we look into it from the pharmacological point of view, and it's really the same. Let me say this. So we when we treat, for example, we treat blood stasis. So blood stasis, at least in the Chinese medicine, is one syndrome pattern, and we see the signs. But normally we do not translate this. But when you're talking about in Western medicine, then blood stasis could be a thrombotic disease. And when we look on the herbs which are treating these diseases, then we found them to be antiplatelet and to have an anticoagulant function. And for me, it's incredible. Or that we use herbs, or they use normally other herbs to support the middle. And we use them now, for example, for the treating obese people. And when we look on the front, then we see that this herb has an anti-diabetic function. So this is incredible. So we can translate the Chinese herbs into the Western function, and that works. And this is amazing when you know what they are doing 2,000 years ago, and now we can prove that it works. And it's really it's great.
I also get, I think about how do they know this 2,000 plus years ago? With only today's technology, we can confirm it. However, it's not surprising. So many of our pharmaceuticals, our drugs, are based on plants, right? And so rather than ignore the Chinese herbs, don't do the Chinese herbs, it makes sense to keep studying them, because they obviously have figured something out. And now you're seeing the herbs that they say are good for this. We see that they're anti-diabetic. The herbs that they say are good for blood stasis, circulation issues, we're seeing they're anti-platelet. you're seeing that they were correct. They used a different language, and so it's wonderful to hear it from you as well. I'm, you know, how you're amazed that it's 2,000 years old. I've been doing this since 2000, since the year 2000 practicing, and I'm sitting here amazed that I'm hearing REI talk about Chinese herbs. So I'm sitting here going, this is pretty cool, because back in 2000, there weren't, I don't know, too many REIs getting excited about acupuncture, Chinese herbal medicine. And here we are recording this in 2021. And I really love the fact that I'm seeing the integration happening in my lifetime that I've always wanted for the public, for the patient, where they get the best of both worlds working on them, you know, working on, we call it the terrain, the individual in two different paradigms coming at it. I think it's excellent. So thank you. Thank you for putting that professional talk together. Thank you for making some time to share with the public. If you're in Graz area in Austria, then you can look up Dr. Ursula Ritz. Her website is GYN-TCM, as in traditional Chinese medicine, -praxis.at. And if you're somebody, the public, and you're looking for integration and you're not in Graz, then look at who shared this. It's likely one of the practitioners from the IFS, and they're probably practicing integratively. And if you're in Vancouver, BC, Canada, then please check out AcuBalance, because we practice this way with the IVF clinics locally. We have an integrative practice. Ursula, thank you very much. I appreciate your time today.
Thank you, Lorne, for inviting me. It was really a pleasure to be here. And I'm very proud to be part of this symposium. It's really, really great.